We're live.
All right. Good morning, everyone. Thanks for joining us for our next community conversations. I'm Mike Skelton from the Greater Manchester Chamber, and we are really excited to have Mayor Joyce Craig with us this morning to get an update on how things are going in the city and talk about a whole bunch of topics. Just a reminder that our format for these community conversations is meant to be very informal and conversational based. So if you have questions, please submit them. There's an Ask a Question feature down the bottom of your screen. You can type in a question there. I'll be monitoring that. The chamber staff will be monitoring that. And we'll get to as many questions as we can this morning. We've got a big group, so hope to do that. So first, Mayor, thanks for being here. Thanks for joining us. And how are things going? How are you doing?
Good. It's a pleasure to be here with all of you. And it was interesting when I was looking forward to this call. One of the last major events that we did was the State of the City with the Chamber. So it's good to be back with everyone. We've certainly missed seeing everyone during this pandemic.
It's funny you bring that up because I was reflecting on that too, that I can't recall the exact date. I think it was right around like March 15th or 16th was the State of the City, or maybe a few days before that. And at that time, we were talking about this issue, and we had made some preparations. You know, you and I, we didn't shake hands that morning. We bumped elbows because we were started to implement some social distancing. But at that time, I don't think any of us could have predicted or thought how quickly it would accelerate the situation and ultimately what it would lead to. Maybe take us back to around that time, and the city was already making preparations. I know from talking with our public health director, Anna Thomas, but you know, what were you guys really preparing for at that time, and how do you think that helped with the response since then?
We have an amazing group in the city of Manchester from a department head perspective, and they had instituted the EOC on March 2nd. So obviously saw this coming, had put everything together in terms of planning and preparation to address what was coming. But to your point, I don't think we really knew. I mean, it is new to all of us. But the level of expertise and preparation from the city of Manchester, the police, the fire, the health department has really been incredible. Again, that was on the 2nd. I think our gathering was on the 15th. We saw the first positive case in Manchester, I believe, on the 18th, and then it just rolled forward from that. Since then, I know you've had Anna Thomas speak to the group, and I'm sure she did an amazing job, as she always does. But they have instituted testing throughout the community. We've instituted a hotline for anyone to call with questions related to COVID-19, and that number is 668-1547. It's available Monday through Friday, 9 to 3. There's extensive contact tracing throughout the community, which is critically important to understand where the source of the virus is coming from, and are just doing a lot of outreach into the community as well. But it came quick. We closed schools before the state closed schools. So I think in Manchester, I can say with confidence, we've made decisions in a rapid pace, always with the health and safety of our community and data driving our decisions.
I think that's a really good point you brought up about how the city and the health department kind of sprung into action. And there's so much discussion right now on contact tracing as being one of the strategies we need as communities, as state, as a country to navigate this going forward. And I think it's really notable that, and I know this from what Anna has briefed us on in the past, that Manchester was really one of the first communities that had the ability and the capacity to start contact tracing early and doing it at a level that was able to achieve results. And now that's a feature and a service that everyone's trying to stand up across the state. So it's good that we had that capacity early and we knew how to tackle that.
Yeah, our public health department is really top notch, and I feel like they've always operated in this fashion, but now they're finally getting recognized for all of the work that they do. And thankfully, many of our nurses from the schools were available for the health department to utilize and sort of move over into this contact tracing environment. I can speak firsthand. As many of you know, my daughter tested positive. She had been studying abroad in London, came back, was self-quarantined, found out that someone she had close contact with in London had tested positive, so was tested. Thankfully, she was completely asymptomatic, but we got calls 2 times a day from the health department checking in on her temperature and extensive questions at the beginning after she tested positive of who she had been in contact with. And so for me, it was, it was a very difficult situation, but it was interesting on the professional side to actually have lived through what they did and all of the work that they put into this for one person, and that they're doing for hundreds of people throughout the city.
Right. And I think it's important for people to hear kind of what that process entails, because when you hear the term contact tracing, I think people get concerned at times, like, well, what does that mean? Is my privacy going to be invaded? But, really, it's a process by which public health is trying to, use your willing cooperation to find out who else might have been exposed and then contact those people. It's, this is not, some sort of, tracking on your phone or something that is I think a negative or concern. But it really requires kind of this collective action on all of our parts, that if you're part of that, system, and someone calls you and says, were you here, or who did you bump into, our collective action can really have a big impact. And I know from what Anna has said is, given that Manchester is a city and it's the, certainly the densest populated area in the state, these strategies really matter in terms of managing and controlling the spread of the virus.
And one of the dangers of this virus is that you can carry it and be asymptomatic. And so that's why the contact tracing is so critically important, to know who you've been in contact with and possibly not even realize, that you are carrying this virus and could spread it.
So I want to remind everybody, if you have questions for the mayor, please pop them right into the Ask a Question feature, and we'll get to as many of them as we can. Mayor, I wanted to just get your sense on where you kind of see the public health situation, right now. I know you're constantly in contact with the EOC, and obviously Manchester, as we're talking about, being a densely populated area, is an area where the virus has been able to spread faster than in other parts of the state that are more rural and less densely populated. But a positive trend overall has been that we have not seen the level of outbreaks in southern New Hampshire that we have seen in neighboring states like Massachusetts. So where do you see us kind of on the flattening the curve journey, and what are your kind of major concerns kind of looking ahead? Obviously, the outbreaks in the long-term care facilities are extremely important and concerning because of the vulnerability of those populations.
Yeah, it's a really good question. So the numbers right now in New Hampshire, there were 3,868 positives. There are 1,388 that are recovered, and unfortunately 190 deaths. In Manchester, we've seen 938 total individuals who have tested positive. And just yesterday, there were 149 positives statewide, and 70 of those were in Manchester. And as you mentioned, 51 of those were at Villa Crest, which is a long-term care facility. So there may be a flattening out statewide. I need to look at those numbers. But in Manchester, unfortunately, we're not seeing that flattening out yet. We're still seeing an increase from a trend line perspective. So it's critically important that people understand that this is still happening in the city of Manchester, and how important those things like washing your hands, wearing a mask when you're out, the social distancing of at least 6 feet, not gathering in groups of more than 10, just taking every precaution that you can to ensure that you are doing your part not to spread this virus.
Message, and one that as we start to gradually reopen some things within our community, within society, which I think is kind of inevitable because we can only be in lockdown for so long, that truly, to a large extent, how we impact this is in our own hands. And those things like washing your hands and social distancing, avoiding large groups, and the masks, which has been kind of within the last several weeks, I think a much more attention put on that and how that can have a significant impact on slowing the spread. What's your sense of are you concerned that not enough people in the community are abiding by some of those recommendations? And what would be kind of your call to action or advice for businesses or organizations as we start to gradually reopen on the importance of our collective action, embracing those things?
Yeah, it's a great question, and I think you hit the nail on the head. It's a delicate balance. We want to do everything we can to encourage businesses to reopen. They need to, from an economic standpoint, but we have to balance and ensure the health and safety of the workers, the city workers, and our community at large. So if you take the example of restaurants opening this week, it was great collaboration with the chamber and with city departments to think of ways to encourage these restaurants to get the most out of what they can do, which is literally just serving outside. So expanding space on sidewalks, allowing them to have tables in their private parking lots, and in some cases even providing public space that is city owned near a restaurant. But we are asking those restaurants to abide by the guidance that's set forward by the state in terms of ensuring that the tables are 6 feet apart, which literally means that they should be about 10 feet apart so that the people sitting there are about 6 feet apart, and ensuring that there's appropriate space on sidewalks for individuals to walk and stay as far apart as they can from individuals at the restaurants, and wearing masks and again, the cleanliness of the restaurants and ensuring that the staff is taking every precaution that they can. Sure, if I wish that more people were abiding by these rules, absolutely, because to me, if the sooner we can get out of this, the better. And I don't want to be in a position where we open up too quickly or individuals aren't abiding by these guidelines and we find ourselves in another situation where we have to close everything down again. That
Right.
would not be good for anybody.
No.
And and again, it's thinking about the health and well-being of our community. And as I said earlier, there were 190 deaths in the state of New Hampshire, and I don't want to see another one. And so I really hope that people do start understanding the severity of this virus and doing everything they can personally to ensure that we are not spreading this.
Yeah, I think just speaking on behalf of some of the businesses that I've interacted and talked with, they very much want to do everything they can to adhere to these guidelines, to exactly your point around another shutdown or lockdown that would see closures or reduced operations is really going to hurt them more so than they've already been, and be difficult to recover from. And I think on this point of kind of the social distancing and what individuals can do, one area that I'm becoming sensitive to, and I know I look, I'm going to look for ways the chamber can communicate this. I'm seeing more and more businesses post signs asking customers to wear masks, and almost all state guidelines that are coming out are asking for employees to wear masks while they're serving food or they're running a retail store or whatever the different thing is. And I think we can all do a lot if we adhere to those requests from business owners, that when you come into their store, into their restaurant, respect their wishes, that you partake in the same social distancing guidelines and health guidelines that they're asking their employees to do. And that's a relatively simple thing. I mean, none of us want to wear a mask. We kind of feel silly doing it sometimes, but in the grand scheme of things, it's a pretty minor inconvenience if it's going to have any sort of impact on keeping us healthier or safer. I have a question here on timeline on reopening public transportation in the city with, there's many families who rely on public transport. And if I'm not mistaken, I think, didn't MTA recently announce that they're reopening some routes soon?
Yes, they did. And I believe it's next week.
Okay.
Or I have Shannon checking, but yeah, they just did put out a press release. They are still doing, ad hoc transportation. So if you need a call, if you need transportation and you call, June 1, it's starting back up.
June 1. Okay.
That information to you, Mike, so you can get it out to your members. But absolutely, unfortunately, they were finding that there were health risks, on the bus and had to shut it down. But we do want to do everything we can to ensure that people are getting to jobs as businesses are starting to open back up. So June 1, bus transportation will start again.
We'll try and post a link to MTA in the chat of the forum here for people to look that up. You mentioned the outdoor dining and how that was ramped up this past week, and just anecdotally, I've heard that it's going pretty well. That there's been thankfully with all the good weather, it's given people a chance to get outside, and that there's been, I think, a number of businesses have been able to take advantage of kind of the creative options that the city has put forth to expand outdoors. What's your thoughts on how things have gone this week? And it seems likely that when it comes to dining, this could be the new normal for a decent amount of time. I mean, at least some of the data or studies that I've seen thus far is that the risks of transmission indoors versus outdoors are just dramatically different. And so, this could be, it's in some ways a good thing that we have the summer ahead of us, where hopefully we'll have more weather where people will be more interested in eating outdoors. But how do you think this week has gone? And I know that the city has had some discussions about ways we could offer more options in the future as hopefully the health situation improves as well.
Right. I mean, anytime after the winters that we encounter, we're so grateful to see sunshine and nice weather. So I think, to your point, yes, everyone is happy to be outside and is really looking forward to sort of getting back to the norm that we're used to, which is, having a bite to eat and a drink sitting outside at a cafe. So it does seem like things are going well. We did our best to try to pull this off very quickly. So in a way to not charge restaurants, we know the significant financial hit that they've already taken. So I think the city clerk, the health department, the fire department, the police department, the planning department have done a great job sort of pulling together and getting what they need out there so restaurants could open up quickly and easily. And it is interesting to see how some have utilized space that they've never utilized before. And we're getting requests now from restaurants or small stores, corner stores, who are interested in using sidewalk space that they've never used before. So I think it is something that, in the future we may see as the norm. And as we've looked into this, although we probably won't be able to pull off some of this year, but cities like Boston and Newport and a few others are doing these things called parklets, where they take a parking space or two or three restaurants or a business, and they build out something that's permanent for a season, and there's a permit associated with it. But it's a really interesting concept that we've pulled out to say, this may be something that we should move forward with in the future. There's been talk about closing down Elm Street for a day or a weekend at some point when it's safe to do. We know that individuals love the taco tour, but again, it's something that we're having conversations on. But we have to always, given the situation that we're in, and this pandemic is still here, and again, the numbers have not flattened in Manchester, we're not at a point where we can embrace having a large gathering of individuals. But we will be prepared with information. So at the time where we can do it, we hope that we'll be able to.
That's great. Yeah. And just for everyone to, for those to be aware, what the city has offered and allowed is that businesses or restaurants can not only use their existing sidewalk space, but they have the opportunity now to use private parking lots as well as neighboring sidewalk space that might belong to another tenant or another business that doesn't plan to use it. And I've had the same observation, Mayor, where I've seen a lot of new creative floor plans that businesses have been able to utilize through this. And there's it's hard to find in situations like this, but I think there are silver linings at times when businesses and restaurants and other downtown stakeholders are going to be able to find things that work in this environment that are just good ideas that are going to stick around long after we get through this. So that's a good thing. And if we find a way through this whole process to make better use of public space for these types of activities, that'll be a really good positive trend. So hopefully that keeps up. And I'll also remind everybody that we had Manchester Takeout Day last week, and it was a big success. And we've been getting great feedback on that, and hopefully we'll do a few more of those. So if you can't make it out to Outdoor Dine, don't forget to keep ordering your takeout. I know that's they really count on that. So moving on to another topic, Mayor. There's a lot happening at the state and federal level in response to this pandemic, and obviously the CARES Act brought a lot of additional resources to the state and to some key stakeholders responding to this. There's now discussion of another relief bill at some point being moved forward through Congress. I'm just, as mayor, what would you look for as priorities for the city in a future congressional action around relief in response to the pandemic?
Yeah, so I feel like in New Hampshire and myself, I feel very fortunate that our representatives both in the Senate and Congress are advocating for direct funds both to the state and to the city level. The last bill that passed had funding going to cities, but the population was 500,000 or more. So I think all of 32 cities got funding directly. And although Manchester has benefited from the $1.25 billion that came in from the CARES Act as a result of the governor providing $2.6 million to the city, it's for reimbursement for efforts associated with combating the COVID-19 pandemic, but it cannot be used to help with a loss in revenues in the city. And so that's one thing that we are looking for. We do anticipate a loss in revenues, like other businesses, almost every other business does. So we would look for funding for that. The current bill as it exists right now, which we know won't stay as it is, but it would bring $127 million to Manchester over a 2-year period. And so, the hope would be, again, to be able to affect and the revenues, but to help small businesses and assist our hospitals, infrastructure. There are a number of avenues in Manchester that we could use these funds to help us in terms of getting moving the city forward while at the same time still addressing the needs from as a result of this pandemic. The other thing that we need funds to address are affordable housing and help with individuals who are not housed in the city of Manchester and, quite frankly, throughout the state.
Mm-hmm. You mentioned before we kind of dive into some of those topics further, but the finances of the city, and I know that's been talked about at recent aldermanic sessions. And could you just kind of bring everybody up to speed? If we have a fiscal year ending at the end of June for the city and then starting a new budget cycle, how are we forecasting to end this year? And then looking ahead, that's still a little bit uncertain, but what do you think the general outlook is?
Yeah, so if you had asked me a month ago, it was extremely concerning, and I think that we were about a couple $1 million and anticipating a couple $1 million in deficit, and having to utilize funds from our rainy day account, which is at about $13 million. Something that the account is there for situations like this when there's a loss in revenue. Excuse me, but it's the last thing that we want to do. The last forecast that we have from department heads that we received this week is that they're anticipating about over a $600,000 surplus as we end this year. So we're really in a good place, especially considering that we're fighting through a pandemic. I attribute it much to the hard work of our department heads managing their budgets, managing their departments. I instituted a hiring freeze. So they are all doing an awful lot and doing more than their typical job description today than they would be because we've held off on hiring, and that saved over $1 million in the last quarter of this year. We're also seeing permits still continuing to come through. We have seen tremendous economic development, as you know, over the last year. So we were really in a great place. And then the COVID-19 pandemic hit. But we're still seeing progress as we go through this. So again, ending this fiscal year, we anticipate $648,000 surplus. And as we head into next year, I put forward my budget with a minimal tax increase. Again, prior to all of this happening, the aldermen now have an opportunity to work on a budget. And I hope that the budget that comes forward has a 0% to very little tax increase, because we really need to make sure and, understand the situation that we're in. We're all in. We're all suffering financial hardships as a result of this. And we need to, reflect that from a budget perspective in the city of Manchester.
I wanted to ask about is the you kind of noted it in the discussion of the future relief bill, is that the state and then by proxy Manchester received a lot of resources to help those in need, particularly our homeless population. And that's also been an area where there's been a lot of media coverage and community discussion around that population, how vulnerable they are to this pandemic, and also the pressure on our shelters and some of the encampments that have been set up, and the city's policy around those encampments, and why temporarily it's been important to leave them so as to not facilitate the potential spread of the virus. And I'm just wondering if you could touch on, I know the city has done a lot in this area, and if you could just touch on some of the actions that you've taken, but just also what people should know about homelessness during the pandemic, and why it's really a unique circumstance for which is always a very difficult, complex issue, and a pandemic makes it even more so.
Yeah, you said it very well. It really, really does. Again, working collectively with the CFC and many of the nonprofits and faith-based communities in the city, we worked through the situation. But what we found was individuals were leaving the shelter because they didn't feel safe in the shelter, in terms of they thought that potentially they would get the virus while they were there. At the same time, the shelter took precautions on their own and were not accepting new individuals into the shelter. So with all of this, social distancing is critically important. Shelters are not set up to social distance, right? Over the winter, we had 138 individuals sleeping in bunk beds and on mats at the shelter. And during a pandemic, we couldn't have that. So they needed to decompress. So what they did was they had their shelter. They opened up a temporary shelter over at St. Casimir that had 40 beds. At the same time, they opened up what was formerly Angie's Place to be a quarantined area. The health department went in and tested everyone at the shelter, and thankfully there wasn't a large spread of the virus there. But we did have individuals that were leaving the shelter and living outside. And the CDC guidelines at the time were very strong in terms of provide shelter whenever you can. Where our shelter was closed, we did not have hotels that were accepting individuals. And if you didn't have shelter, it was critically important to provide support to camps and leave them where they were, because that was the safest situation for those that are unsheltered, as well as the community at large. So I'm grateful for the partnership with the state, because what they did was these camps were set up and they were not living in a situation that was healthy. There was trash everywhere, and the camps were not were not in a good condition. The state came in and did extensive cleaning and sanitation of the campsites. They provided porta toilets, hand washing areas, and then provided funding to provide food to the camps 2 times a day, and then mental health counseling and outreach and other outreach facilities to come in to help the individuals who are there. Again, always, tough decisions. And I know that people don't like to see this, but it was a situation where we needed to do what we could to, again, ensure the health of the individuals who are unsheltered and the health of our community at large. This is a temporary situation. So now we are working with the Fit New Horizons shelter. They are accepting individuals back into the shelter, continuing to do outreach to individuals so that they feel comfortable going back into the shelter. But it's important to note now, just the shelters, just like daycare centers and our camps and our schools, we have to institute social distancing. So where once we had 138 beds, now we have 59. So we're trying to identify locations throughout the city, again, to make sure that there are beds for people who are unsheltered who want to be there. We know, I think it's important to say, in Manchester, we've always had individuals who have lived outside, and we are not ever going to be able to get everybody who lives outside into shelter. I wish we could, but that is not going to happen, and I think it's unrealistic to expect that. But if we can provide shelter to individuals who want it, and over time, get them there, and then get them into supportive housing, which is critically needed in the city and the state, and into long-term housing, that's the ultimate goal. And you talked about a silver lining earlier, and for me, there's a silver lining in this pandemic because it's brought attention to something that we have been talking about in the city of Manchester for a number of years, in that there are not enough emergency shelter beds in the state of New Hampshire. There's not enough supportive housing. There's not enough affordable housing. And we're finally seeing funding coming in and conversation about this. So I'm optimistic that over time now there's focus, because we're not only seeing these tents pop up in Manchester, they're popping up in communities who didn't think they had homeless. With this pandemic, individuals are not in a place where they can couch surf anymore, so they're living outside. If you go to Concord, you're seeing a lot more tents. So this has become visible in many communities throughout the state. So again, the attention is there, and the more voices that we have advocating for solutions on this front, the better.
And I just wanted to add one thing, a topic that we've talked a lot about, particularly through the Mayor's Task Force on Homelessness, which has been ongoing for the past year and a half, is when it comes to homeless activity downtown, and particularly people's perceptions of panhandling. We may see that activity come back in the future, it kind of, with downtown being relatively quiet and for the most part shut down over the past few months, there's been very little panhandling activity. But I know I've started to hear, and I'm sure you have too, concerns and complaints about that coming back. And of course, as we always try to remind people through this, that not all homeless people are panhandlers, and not all panhandlers are homeless. And so they're really different issues, but they're very much intertwined and mixed together. But in this particular environment, as you've kind of noted, the homeless population, there are more resources available to them through this than really under normal circumstances or any time before. And so the best way that we can help them is by getting them connected with those services, getting them to one of those service providers or shelters, or one of those, some of the things that are being offered at those camps. And that the panhandling activity, if a person is truly in need, the dollars that someone on the street might give them may go to harm them and not actually help them. And as you know, we're working with the city and the health department on a campaign around that we're going to be launching soon. We had planned to launch it this past spring, but obviously was delayed due to the onset of the pandemic. But I feel like that is going to be front and center on everyone quite soon, in that we really need to be mindful on how we can best help as individuals, as community members, those that are in need, and that it's human nature to want to help someone who we see in distress on the street, but that connecting them with resources is really the best way to do that. And we may actually be putting them in danger by giving them money or food on the street when they otherwise could be getting connected to services that are more readily available than ever before.
Exactly. And there's a cause and effect here. And to me, it's very, very obvious. When our downtown was shut down, as you mentioned, and there were virtually no one down here working or enjoying their time, there was also no panhandlers. There was no one here asking for money or sitting on the sidewalk, living on the sidewalk. And now that things are starting to open up, we do see people down here again. And it's because they're getting money and food from individuals who are downtown. And like you said, now more than ever, there are so many resources in the city of Manchester that are here to help individuals who want the help. And so I think it's really important to educate the public at any point that we can, and especially in Manchester, because we have such a giving community here. But if you want to provide help or give to someone, the best way to do that is to give it directly to the nonprofit who is doing that outreach or providing the hot meal to someone in need, but not to give it directly to someone. I can't stress that enough. One thing too, I'd like to just touch upon, and because it's something that we get asked a lot, why can't you just tell someone to get off the sidewalk who's looks like they're living on the sidewalk? And a sidewalk in this country is fair game. You could decide to sit on the sidewalk. I could decide to sit and stay on the sidewalk, just like someone who's homeless could decide to sit on the sidewalk. So although to some who are visiting our downtown, it feels like we should be able to tell someone to move on. If they're not blocking a walkway or an entranceway to a business, they have a constitutional right to be on the sidewalk. So I just thought this would be a good opportunity to mention that, as much as it doesn't seem logical. That is the right of anybody they have in this country.
So in the time we have left, we have a few audience questions I'd like to get to. The first is around public schools and thoughts on public schools being open this fall. Obviously critically important, not only to the families that they serve and the education benefits for Manchester kids and the services they get access to through that, but also for working parents who rely on that as part of their childcare and their ability to be able to hold down their jobs. So I know this is something that the city and Dr. Goldhart are looking closely at, and I'm sure has been discussed at the EOC. So how do you see that process about figuring that piece out coming together?
Yeah, Jen Gillis is leading the effort there, working with Dr. Goldhart and communicating with the EOC. I am the mother of a junior at Central High School, so I'm seeing it firsthand myself. She's actually taking an AP test this afternoon. So they're continuing. They are pushing these kids as much as they can, working remotely. I can't say enough about the hard work of our teachers. Again, this was done in the blink of an eye. We had to close schools immediately for the health and safety of our staff and our kids and our families in the city of Manchester. It's not something that we wanted to do, but had to do. And our teachers and administrators had to really, in days, changed drastically the way that they teach our kids. I think that when we open up schools, it's going to look very different than what we had experienced before. And I know conversations are happening. I don't know. I wish I had an answer to what it would be in September. I don't know. But, the conversations have been in terms of, whether we're going to have to stagger, have some kids work in the morning, some kids come in the afternoon, or different days of the week, how social distancing is going to work into this. But we are going to do our best to get kids back into school in September. We know that there's going to be loss as a result of this nationwide. But again, these are things that we had to do in order to keep people safe.
Right. And part of the formula here too, and just beyond the education system is kind of the after school programs and the daycare programs and daycare schools and the like. And I know that's kind of separate outside of the public school system. And there's been recently guidance put out by the reopening task force of the state around some of those programs. But it sounds like, they're having to change their operations quite a bit. I know my daughter is enrolled in a daycare, and we just have been getting communications about all the capacity restrictions that they're looking at and new protocols and guidelines. And, is that a conversation you're hearing too? Because the schools and the after school programs in Manchester are so intertwined.
Yeah, the Boys and Girls Club, the YMCA City Year, although they're separate from the school district, they are integral partners to the success of our kids here in the city of Manchester. They'll go to those programs before school, go to school, go to those programs after school. They are working with our kids, and I believe strongly that our kids are not going to succeed without the help of these programs. And so it's all, it is a strain, and there are so many unknowns, and this social distancing is affecting them. I recently had a call with the Boys and Girls Club and the Y, talking about, how is this going to look in the city of Manchester, and when are we going to be able to move forward? And I know those conversations are happening at the state level. I think if we could count on every day of the summer being a wonderful, sunny, warm day, we'd be, in much better shape. But when we have to pick up kids on a bus and get them somewhere and potentially have to stay inside, it's a different story.
Sure.
But, how do we navigate that? I was thrilled to see that the Boys and Girls Club are starting a daycare program now, and it seems to have been very successful on a small scale. But again, our kids in Manchester need support, and these programs play an integral part in their lives. So I hope that in the near future, we can build that up so that they can be part of the solution.
We have time for just a one or two more questions, and there's one about the financial viability of our healthcare system. And there was an op-ed from Dr. Pepe and Dr. Baxter just this week about the just enormous impact this pandemic has had on our two hospitals, which we are very fortunate to have here in Manchester, both from an economic standpoint, but first and foremost from a healthcare standpoint, the services they're able to provide us. And I'm just wondering kind of your conversations with them about the healthcare system, and that I know this is going back to the discussions about aid from the state and the federal government. This is something that they're looking at it and lobby, there's a lot of lobbying rightfully going on to make sure that those resources get to the healthcare system, who essentially had they shut off an entire portion of their business for 2 months in order to respond to this issue, and now are trying to find a way to build back up.
Yeah, I mean, it's critical that we get funding to our hospitals as soon as possible, and that's been one of the problems. It's been slow coming. The commitments are there, but the funds are not getting to where they need to be. And the two hospitals in Manchester are providing services for the majority of individuals who are testing positive for COVID. So, it seems like we continue to say this. Manchester, being the largest city in the state and having the most services and the most expertise, we tend to get the most business, whether it's for healthcare needs or other, coming into the city of Manchester. So we really need to make sure that our hospitals make it through the situation and can resume business as normal once this is over. They were an integral player in setting up the additional beds over at Southern New Hampshire University as well, which thankfully we haven't had to utilize. I am happy to see that they are starting to get back into accepting patients again now, because that's obviously necessary. But we are doing everything we can from the city's perspective to help them with getting the funds that they need. And the leadership at the hospitals has been fantastic in terms of communicating to the city and to our community what's happening there. Unfortunately, they were in a position where they had to furlough employees, but again, are trying to get them back. and communication through this pandemic has been fantastic, and I'm grateful for that.
Absolutely, and it's also been great to see them getting recognized both locally, regionally, and nationally in some cases of the work they were doing. There was that wonderful story on ABC News recognizing the care at CMC for an individual who unfortunately passed away, and their relationship and communication with the family. So I think it showcased what we know we've always had here, which is really some amazing top tier healthcare professionals in our community.
Exactly. I mean, this all is such a difficult situation, but if you think about a family who has a family member in the hospital who's sick from COVID-19, and you can't spend time with them because of this virus. But we know in Manchester, like you said, we have these amazing medical professionals who are so caring and compassionate and understand the situation and go above and beyond to make sure their patients are comfortable and know how loved they are. It was so great to see that they were nationally recognized for that.
So last question, and actually I think it's good that this came in because I think we have an answer to this, is that it's around the city setting up a local service or volunteer model where people who are interested in helping out, if they have the capacity to help out, can participate and do so. And I believe that is something the city has set up, and there's a link on the city website for someone to be able to complete a form if they have the ability to help out a neighbor or help someone who is in need.
Yes, we're partnering with Volunteer New Hampshire, and it was a great opportunity for us, their expertise to have this here, because again, we have this wonderful community who really has stepped forward in terms of asking what they can do, whether it's a financial contribution or time to go get groceries for someone or to volunteer at the food bank or at the shelter. So there is a link on our website. There are opportunities listed as well, specific opportunities, so you can look through those to determine, what, if anything, is appealing to you to help out.
Great. Well, thank you, Mayor, for your time this morning and all that you and your team and city department heads and employees are doing in response to this. We really appreciate it. And please keep in touch. Let us know how we can help, how the community can help, and we greatly appreciate the continued partnership.
Thank you so much. I appreciate all that you're all doing too as well.
Thanks, everybody, for joining us. We look forward to having you at a future community conversation. Keep on a lookout for those announcements. And just as a reminder, all of these sessions are being recorded and they'll be posted on our YouTube channel and website and social media going forward. So we appreciate it. Thanks, everybody, and have a great day and enjoy the weather. See you soon.